young people aged 18 to 29, without health conditions, are some of those least likely to be directly affected by serious illness caused by COVID, which is why today the advice about what vaccine they should be offered changed. Over the past few weeks, we've heard concerns about certain types of blood clots associated with the AstraZeneca vaccine, which has already been used on millions. And today, both the European and UK medicines regulators said the evidence that it may be a vaccine side effect is getting stronger. But they stressed overall the benefits outweigh the harms. So what's happening to people who do develop blood clots after the AstraZeneca vaccine? It may have something to do with platelets, tiny particles that help blood to clot.
So what we're seeing is that patients have blood clots with low platelets, and they have low platelets because they have developed an antibody against their platelets, and they are activating them. So the platelets are all going yippee and forming clots everywhere in a very aggressive way.
The overall numbers are extremely small, and COVID itself can cause blood clots at a much higher rate than those associated with the vaccine. But today, the Deputy Chief Medical Officer said the under-30s would be offered a different vaccine to the AstraZeneca one, where available.
The NHS has a message that we will get the right vaccine to you in the right time, according to the new JCVI advice. There might be a small delay sometimes. There might be a slightly greater distance that some people are asked to travel. But the NHS is all over this and understands the challenge. Vaccines continue to be the way out for the UK. They continue to be the way in which we can get our lives back to normal.
In medicine, clinicians balance benefits against the harms. These may be marginal for a person under 30. Their risk of serious illness from COVID needing intensive care admission is lower than in other age groups. But some UK regulatory data suggests they seem to have a slightly higher risk of blood clots. These are early data and evidence is still accumulating, as it is for all COVID vaccines, so there is some uncertainty. According to the analysis, benefits of the vaccine increase when the virus rate is higher, but data is still coming in. It's early days. While attention has focused on AstraZeneca, experts will be looking at other vaccines. The European regulator is looking at those using a similar technology.
The honest truth is we have no idea at this point what the mechanism is, and we therefore have to be completely open-minded about the possibility that we might see this or other signals with other vaccines as they come through. Most of these vaccines are entirely novel platforms. They've never been used in humans before.
Symptoms for these rare blood clots occur 4 or more days after vaccination and include severe headache, blurred vision, shortness of breath and unusual bruising. It's not yet clear what the risk factors are, but there are treatment for those with these clots.
Everyone will be awake to the phenomenon, and so we will get patients diagnosed very quickly. And that is key. So if we can find patients who have thrombosis and low platelet counts, they also have slightly other changes in their blood, which also help identify them, then they need to be treated as soon as possible.
Today saw the launch of another new vaccine in Wales, made by Moderna. Experts advising the government said the advice not to offer AstraZeneca to under 30s shouldn't slow down the UK's rollout.
This policy change is quite unlikely to influence the overall rollout, simply because the majority of people under the age of 30 who are in good health will not in any case be becoming eligible for vaccination for yet a while. So I think there's a reasonably good chance, if the supplies do come through as expected, that this really won't disrupt things to any great extent.
As vaccine programmes roll out across the world, we'll learn more and more. But after tens of millions of vaccinations so far, experts still say for adults the benefits of vaccination far outweigh the harms.
Deb Cohen with that report, and we're joined now by Professor Stephen Reicher, a member of the SPI-B committee, which advises the government on ways of helping people to comply with interventions recommended by medical or epidemiological experts. Also joining us is Professor Jeremy Brown, a member of the Joint Committee on Vaccination and Immunisation, and Dr. Margaret Harris of the World Health Organisation. And Professor Brown, if I can start with you, perhaps from the JCVI. Some countries have stopped using AstraZeneca for those under 55, for example, Canada, and I think Germany has stopped them for under 60s. Sweden has put it on hold for people under 65. So why does our recommendation only affect the under 30s? Can you explain that difference that we're seeing?
Well, I can explain why we've decided about under 30s rather than an older age range, and that's based purely on the sort of risk-benefit analysis. So if you catch COVID and you're in your age group 20 to 30, about 10 people in a million will die. If you're 30 to 40, more like 40 people will die. And if you're over 40, it's 120 people will die. So you can see that the risk of having a severe infection, and those numbers are doubled for people ending up in intensive care and tripled or quadrupled for those ending up in the hospital. So the risk of getting a severe disease very much ramps up with age. And so compared to the risk of this potential side effect associated with the AstraZeneca vaccine, which is a few in a million, you can see that the ratio of the potential risk of the vaccine versus the risk of the disease, it's much more in favour of vaccinating people when you get above the age of 30.
Is that the same answer if I asked you about the difference between men and women? Because the risk, tiny as it is, does appear to be more prominent in women, but they haven't made that distinction.
Yeah, I think it's very hard for us to know about the difference between men and women, whether there is a true difference, because in fact, in general, more women have been vaccinated because the high proportion of healthcare workers and social care workers and people working in care homes are female rather than male. So in the younger age groups, it's been a higher proportion of women that have been vaccinated. So to get a true incidence of whether it's increased in women compared to men is going to be a little bit difficult for now.
And in terms of how this is rolled out, if I can go to Stephen Reicher now, are you happy to have this clarified tonight? Does this make your own role with SPI-B easier?
Oh, I think today's announcement was very well handled. It was nice to see that it was handled by the scientists, giving clear and objective information without being obscured by too much political speak. And I do think there are two really important points that we need to hammer home. I mean, the first is that if today you had the AstraZeneca jab, it was probably the safest thing you did. It was probably more dangerous to have a bath. About 30 people drown in the bath each year. It was certainly more dangerous walking down the stairs. 1,000 people die falling down the stairs. And it was it was safer than having breakfast. About 200 people a year choke on their food. So it's an extremely safe thing overall. What's more, if we look at the news in the round for today and put things together, then actually there is more reason to believe that you are protected by the vaccine than that you might be harmed by it. So a study came out today showing that of those who've had severe COVID, 1 in 3, 33%, have mental health problems. So overall, if you look at the balance, actually the balance is becoming clearer in favour of the vaccines.
I think most of us understand the balance of risk and how that massively outweighs. But we just heard a scientist in Deb Cohen's package say it's really important that people can be awake to the phenomenon, that actually once it's spoken its name, if anyone, tiny as that is encountering symptoms, then they just get diagnosed more quickly. So it's helpful all round to have these things out. Would you agree with that?
I think the information is absolutely critical. I mean, when we started the vaccine rollout, in SPI-B, we argued that it needed to be accompanied by an information rollout of the same order. Now, I think we've done quite magnificently in terms of the rollout of the vaccine itself, in terms of the number of jabs that people have had. We haven't done quite so well in terms of the information rollout. So people haven't been given the information they need, both about the consequences and possible consequences of the vaccines, nor about the behaviours that are necessary in order to stay safe. And I think this is a very good object lesson in how important transparency is. If you fear that if you tell people negative news it will put people off, then danger is that it comes back to haunt you later, as indeed it is today. If you're absolutely open right from the start that the vaccines are very, very good, but we don't need to overstate them. They're not perfect. They will have side effects. There will also be adverse effects which correlate. If you vaccinate enough millions of people, then some pretty bad things are going to happen to people. And I think we've got to trust people more, be more transparent with information, not overstate the case, and then it doesn't come as a surprise, the sort of things that happen today. In fact, to me, one of the most interesting things said today by Jonathan Van Tam was the fact that he's not at all surprised by this. He expected that some things would come out, as indeed they do as we get more data. But overall, what we're discovering is how effective the vaccines are, how safe they are, and this whole process, I mean, this huge process going on because of a very few number of cases show how seriously safety is being taken. And I think those are the messages we need to press home.
Just before I come to Dr. Harris and we'll look at the worldview, I just want to pick up with Jeremy Brown on that question of transparency. Norway, Denmark, Iceland suspended the AZ jabs, the AstraZeneca jabs, almost a month ago after their government scientists expressed their own belief in that link. Now, at the time, it seemed that the European countries were dismissed for that suspension. Does it seem to you now that we were too hasty to judge and maybe that transparency earlier on would have been helpful here?
Okay, so what we did not like about the suspension was their rapid suspension in an age group where the risk-benefit would clearly benefit in carrying on with the vaccination. So many of the countries you've mentioned that have suspended the vaccine in age groups where the incidence of the disease is going up and the death rate is now like 1 in 1,000, 1 in 100, something approaching that order of magnitude. And by suspending the use of the vaccination, they have probably led to more deaths and morbidity and illness than they would have done if they carried on with the vaccine program. That's the issue with their rapid suspension in age groups where the disease itself is likely to cause very severe infections.
Well, let me pick up with Dr. Harris now. Thanks for your patience. But in terms of the rollout now, worldwide, which is clearly where the World Health Organization comes in, the beauty of AstraZeneca was that it was meant to be cost price and room temperature. Do you believe that any of what we're talking about today will affect that rollout in developing world economies?
AstraZeneca remains a beautiful vaccine, a real workhorse. As the other speakers have said, the importance of this information is that the safety system, the vigilance is there and it's working because we are getting reports and we're looking at those reports, looking at every one of them to understand what it means. But in terms of the rollout for us, the big issue is that the cupboard is bare. We need more doses.
And has the pause from any of those European countries helped COVAX get more of the supplies to developing countries, developing economies earlier?
To date, I couldn't say that that's happening. A little under 2 weeks ago, my Director General made an appeal to countries with surpluses to donate 1 million of the vaccines that we can use in COVAX. That's AstraZeneca and Pfizer-BioNTech. And to date, I have not heard of any of those vaccines arriving yet.
So you mean that they haven't? I mean, is that your way of saying they haven't?
To date, yes, we haven't got anything extra from the agreements that we had with the suppliers, and unfortunately, the supplies we thought we would have been delayed because India particularly is dealing with a massive outbreak, and they are using what they've got for their outbreak.
And when we talk about a country like India, which has got a much younger population, we've been talking about age-based risk today, is the lesson not to worry about vaccinating the young at all? Or would you expect the Indian population to carry on vaccinating across the range as soon as they get the vaccination?
So we at WHO have identified very much the priority groups we want to see vaccinated first, and that's the health and social care workers, the frontline workers, the people who are exposed every day, so most likely to get infected, and of course the people in the older age groups, because their risk of severe disease and death is so much higher. And then there's the third group, people with underlying disease. We see those people get very, very ill and are likely to die as well. After that, then countries prioritize. But those groups need to be vaccinated everywhere around the world so that we do not see these high levels of disease and death. I mean, we have lost over 2.8 million people to this, and some countries are recording horrendous daily death rates. And the vaccines, AstraZeneca included, have been shown to bring down that death and disease burden, and that's what we need them to do.